Hi dear students, very good morning. Today we are going to have a PT Ortho related discussion. Today it is going to be a completely video based lecture. There is no activity will be given. Okay, it is for your importance at this point of time because we are not able to meet actually. However, I would like to stress the importance as well as how you can prepare yourself to face a PT ortho practicals. So I'm going to give you a complete scenario, a complete idea about what is PT ortho practicals. Okay, coming to PT ortho practicals, it is a subject that requires informations or knowledge that is already learnt from your previous years and previous subjects. For example, the skill subjects. In order to be very efficient in PT Ortho, you need to have two important things. Number one, the skill portions of physiotherapy you need to be efficient. Number two is the clinical portion of the particular clinical condition. You need to be efficient. Okay, let us coming to the skill. The skill means whatever the PT modality skills you have learned from exercise therapy, from electrotherapy, high frequency, low frequency, exercise therapy, and manual therapy, massage techniques, manipulation techniques, all those things. You need to be very efficient. So those skills should be revised and keep all the principles in your mind, the plannings and skill performance you need to practice. Okay, so during your these holidays, you can practice these skills at your home. That's what I would like to stress over here. Go through the principles, the techniques. Okay, revise them, practice them. Okay. The next thing is the clinical part of the particular condition. When you come to the practicals of ortho, PT ortho, you will be either given a scenario. We will prepare a scenario and give it to you in a small sheet. A typed information will be given to you as a question. Or you will be given generally a condition, a clinical orthopedic condition will be given to you. Suppose if we give you a scenario, you need to plan a PT orthopedic treatment program according to the scenario. Identify what are the subjective problems are there, objective findings are there. Accordingly, you plan. You are going to plan the physiotherapy problem list and physiotherapy aims. Then you have to plan you have to set the goal, the long-term goal you have to set, which is more appropriate for the particular scenario. And then the short-term goals. In order to achieve the long-term goal, you have to split them into various sections that will become your short-term goals and give a lot appropriate time period to achieve those short-term goals. You can make few adjustments as you continue the treatment. After setting the goals, you have to very clearly mention what are the means nothing but physiotherapy treatment modalities. You choose the appropriate physiotherapy treatment modalities along with the dosages. The dosage is very important in terms of how many sets, how many repetition, how long, the duration, everything, the method of application, everything should be very clearly mentioned because it should be a practically convertible plan. Okay. After the means, the treatment modalities are fixed, you need to identify the appropriate outcome measure. Outcome measure is nothing but what are the areas I have to recheck in order to know the improvement of my treatment. How my treatment is working on the patient, how fastly, how efficiently it is providing the prognosis, to check it. Suppose if the prognosis is not good, then you may have to change your treatment plan. Okay, so in order to check the prognosis, the improvement of your treatment plan, you need to identify some areas where you have to reassess. Okay, like pain, assessing the pain, assessing the range of motion, assessing the muscle strength, assessing the function, like that. Whatever the treatment you have given, accordingly the outcome measure should be selected, that you have to perform. So you have to select and keep it ready. Not only the outcome measure, you also have to select the most appropriate measurement tool for that, because you for example, when you have a pain as outcome measure, we have many scales to assess the pain. So you have to identify the most appropriate scale to do that. And then the procedure also, you must be well versed. I will have a separate class on outcome measure, maybe in the next week in the PT Ortho subject, as a lecture I will give you. Okay, so here just I mention in a superficial manner about the outcome measure. Okay, outcome measure you have to select. After the outcome measure, you have to give a clear-cut home exercise program. Home exercise program is always having two sections. Number one is do's and don'ts. What is it? Do's means what are the things the patient should do at home. What are the things he has to carry out at home in order to accelerate the healing process of the problem. He is coming to the physiotherapy, taking treatment, everything is okay, but along with that at home, what he has to do in order to accelerate the healing process. Okay, next is don'ts. Don'ts means what are the things the patient should avoid in order to prevent aggravating the problem, clinical problem. It is equally important, getting treatment and prevention from aggravation, both are very important. So that is what is the stressing of do's and don'ts is very, very important to the patient. And then the second part of the home exercise program is your clear-cut physiotherapy home exercise program, starting from your active exercises, various active exercises, various functional activities, how many sets, how many repetition, how long it should be done. Everything should be clear-cut, fixed, and it should be taught to the patient. And then the final one is fixing the next appointment. So when you do all these things according to the scenario, you need to do the scenario. Suppose if you give only the clinical condition, what you have to do is you have to identify the most common clinical features, the most common problems, physiotherapy problems expected out of the particular clinical condition. You have to identify. Accordingly, you prepare your own physiotherapy management plan and you have to carry out. So when you come to the PT Ortho exam room, you will be given a scenario or a condition, and you will be given a time, maybe 10 minutes time, to prepare a clear-cut physiotherapy management plan on a sheet. You will do all those things from right from physiotherapy problem list, physiotherapy aims, goals, means, outcome measure, home exercise program, and fixing the next appointment. Everything you prepare, and keeping it as a blueprint, you will perform the skill on the patient. The examiner will not interfere you, he will just observe. If there is any safety issue or any doubt arises, which is very important to identify your knowledge level, your skill level, that only will be asked to you. So you have to perform it neatly, starting from the receiving the patient, ending to the ending of the home exercise program teaching and fixing the next appointment. You have to carry out. This is what is going to be your practical examination schedule procedure. Okay, so in this procedure it is very important you have a very good clear-cut skill and very, very good clinical knowledge of the particular condition that is given to you as a question in the scenario. Okay, so make use of this holiday time to improve your skill parts. Okay, of course I know your clinical ortho is also simultaneously going along with your PT ortho, so some of your clinical conditions are still pending to be completed. So whatever has been already completed, you please keep going through. So we have completed some fracture conditions as an assignment part, as well as some parts were already taught in the classrooms. So those things also you can revise. And some conditions were already completed, those things you keep revising them. Keep everything updated. Okay, that's what I would like to tell you. So um, I will have in this practical aspect for the PT Ortho, I will add some more information in the future video presentation, especially about outcome outcome measurement tools, and outcome measurement procedure. These three criterias I will be adding another video, a lecture video about it. Okay, so keep repeatedly, watch this video and try to understand what is expected in the PT orthopedic practicals. Okay, which is very important for this particular year. Okay, thank you very much. Have a good day.